We're back on your side with a safety alert as nearly 90 cases were added to the measles outbreak in upstate South Carolina. 89 cases were reported since Friday, bringing that outbreak up to 789 cases. Right now, there are 557 people in quarantine and 20 in isolation. 3 schools were added to the already long list of schools with students in quarantine. DPH also says 18 people were hospitalized with complications. Of the 789 cases, 695 are people who are unvaccinated and 14 are partially vaccinated. There are 20 cases of vaccinated people and 60 people whose vaccination status is unknown. DPH still says the best way to avoid getting measles is to be fully vaccinated. You can find the measles outbreak website and interactive map on our website, wrdw.com. The American Academy of Pediatrics releasing its recommended childhood vaccine schedule Monday and is continuing to recommend vaccination against 18 diseases for children, including measles. The AAP schedule differs from the CDC's released earlier this month that was confusing parents. That schedule removes routine vaccination recommendations for several diseases. It also downgrades the recommendations for high-risk groups and under shared decision-making when parents and doctors discuss if treatment is appropriate. The CDC took flu, hepatitis A and B, meningococcal disease, rotavirus, RSV, and COVID shots off its broad recommended list and put them on the schedule for high-risk individuals. The agency also changed the schedule for HPV from having 2 or 3 shots to 1. 12 major medical and healthcare organizations representing more than 1 million medical professionals endorsed the AAP schedule, which includes these missing diseases. And according to data from the CDC, childhood vaccination rates are down nationwide. In the 2011-2012 school year, about 94% of kindergartners had their vaccines versus about 92% in the 2024-25 school year. South Carolina is following that trend with rates declining since 2020. You can see those lines right there on your screen, and those are the vaccine trends for each of the recommended childhood vaccines. They've been gradually going down since 2011. In the 2011-12 school year, about 95% of kindergartners had their vaccines. That number has dropped to about 90% in the 2024-25 school year. In that same time span, the percentage of students with any type of exemption went from just over 1% to 4.6%. And Georgia doesn't fare much better. While it doesn't have an outbreak of measles like the Palmetto State, vaccination rates are also down. The lines are back up for you right here. You can see them right now, the trend from 2011 to 2025. From the 2011-2012 school year to the 2024-2025 school year, vaccination rates in kindergartners have dropped nearly 10%, from about 96 to only 86.8%. Exemptions are also up in the Peach State, going from 1% to nearly 5% in the same time span. The American Academy of Pediatrics says that it will continue to recommend vaccinations for children as childhood disease rates continue to rise.
It reflects the best available science, expert consensus, and decades of real-world data demonstrating the life-saving impact of timely vaccination. In the midst of high seasonal flu and RSV activity and a significant resurgence in measles, it is more important than ever for the public to have transparent and consistent communication from trusted sources.
The AAP encourages parents who have questions about vaccines or anything related to their child's health to talk with their pediatrician. And if you'd like to learn more about vaccination rates in the U.S. and in the Sioux State, you can head to wrdw.com, where you can find all of this information that I just shared and more.